Okay, so next we'll be talking about the identification of restorations, dental materials, and foreign objects, which is chapter 32 of your dental radiography textbook. At the start, we'll be going over some learning objectives, and that's to define the key terms associated with identifying restorations, materials, and foreign objects on dental images. Also, to discuss the importance of interpreting dental images while the patient is present. And on dental images, to identify and describe the appearance of amalgam, gold, stainless steel, crowns, posts and cores, porcelain fused to metal, and composite and acrylic restorations. Also, to identify and describe the appearance of base materials, metallic pins, gutta percha, silver points, complete dentures, removable and partial dentures, orthodontic bands, brackets and wires, fixed orthodontic retainers, dental implants, bone grafts, suture wires, metal splints, plates, bone screws, and stabilizing arches. And to identify and describe the appearance of earrings, necklaces, nose jewelry, eyeglasses, shrapnel, and other miscellaneous objects. So, dental images are an important diagnostic tool that enables a practitioner to view dental restorations and dental materials. Dental images are also useful in identifying and locating foreign objects. The purpose of this chapter is to review some common dental restorations, dental materials, and foreign objects viewed on dental images. The dental professional should interpret all the dental images while the patient is present, because if questions arise as to what is seen on the dental image concerning dental restorations or any other foreign objects that we talked about, the clinical examination of the patient can be done to obtain additional information or to verify what is seen. When dental images are interpreted without the patient present, some important clinical information may not be available. Okay, so a variety of common restorative materials, including amalgam, gold, stainless steel, porcelain, composite, and acrylic, can be identified on dental images. Metallic restorations, such as amalgam or gold, absorb X rays, and as a result, very little, if any, radiation comes in contact with the receptor. Consequently, that area of the receptor remains unexposed, and the metallic restorations appear completely radiopaque or light or white on a dental image. Non metallic restorations, such as porcelain, composite, or acrylic, may vary in appearance from radiolucent, which is dark or black, to slightly radiopaque, depending on the density of the material. Of the non-metallic restorations, porcelain is the most dense and least radiolucent, while acrylic is the least dense and most radiolucent. Some amalgam restorations that we'll be looking at in this chapter are one surface amalgam restorations, amalgam overhangs, and amalgam fragments. One surface amalgam restorations appear as a distinct, small, round, or ovoid radiopacities. One surface amalgams may be seen on the buccal, lingual, or occlusal surfaces of the teeth. Larger two surface and multi surface amalgam restorations also appear radiopaque and are characterized by their irregular outlines or borders. Amalgam overhangs are extensions of amalgams seen beyond the crown portion of the tooth in the interproximal region. An amalgam overhang can result from improper band placement around condensing the tooth before condensing the amalgam restoration. So, an amalgam overhang disrupts the natural cleansing contours of the tooth. It can trap food and plaque, and it can also contribute to bone loss. And see here, we see a picture of what an amalgam overhang would look like. And in an X-ray, we see what that looks like here. And this is not a good thing in dentistry when we see things like this. And again, this is as a result from an improper Toffelmeyer or some type of matrix band placement. And if it was a Toffelmeyer, it was more than likely because the Toffelmeyer wasn't tightened correctly, and it results in an overhang here. And here, the problem, what would happen is this area would harbor lots and lots of bacteria. On top of that, when this person goes to floss, this is a natural floss cutter here that would probably cut their floss every time. Also, this can contribute to bone loss. And if you can see above here, this patient is already exhibiting signs of bone loss. You can see that radiopacity in the bone that's there. That's happening as a result of that overhang. So an amalgam fragment is a fragment of amalgam that may be accidentally embedded into the adjacent soft tissues during the restoration of the tooth, or during the placement of the amalgam or the removal of the amalgam. Amalgam scraps vary in size and shape and appear as dense radiopacities with irregular borders on a dental image. We can see a picture of one here. So this would be where that fragment would be located. And it almost appears on an X-ray as if it's inside the bone, but it's not. It's actually embedded in the soft tissue that's surrounding the bone. So gold restoration appear completely radiopaque, and unlike amalgam restorations, exhibit a smooth margin line. So this can include a gold crown or a gold foil restoration. And gold crowns and bridges appear as large radiopaque restorations with smooth contours and regular borders. One surface gold foil restorations appear as small round radiopacities on dental images, and are you can't really tell the difference between a gold foil restoration and a one surface amalgam restoration unless you were to look clinically inside of the patient's mouth. Stainless steel and chrome crowns are prefabricated and usually only used as temporary restorations. These crowns are thin and do not absorb dental x-rays to the extent that amalgam, gold, and other cast metals do. As a result, stainless steel crowns and chrome crowns appear radiopaque, although not as densely radiopaque as amalgam or gold. And because stainless steel and chrome crowns are thin, some areas may appear see-through on the dental image. Post and core restorations can be seen in the teeth treated with endodontic therapy. So the post and core restoration is a cast metal and appears as radiopaque as amalgam or gold. And the core portion of the restoration resembles the prepared portion of a tooth crown, and the post portion extends into the pulpal canal. Porcelain restorations appear radiopaque on a dental image, but unlike metallic restorations, which appear completely radiopaque, porcelain restorations are only slightly radiopaque and almost resemble the same radio density as dentin. So what that means is when you look at an X-ray of a porcelain crown, it's almost the same shade of gray as natural tooth structure, which is a good thing. And all porcelain crowns and bridges are appear slightly radiopaque on the dental image, and a thin radiopaque line outlining the prepared tooth may be evident through the slightly radiopaque porcelain crown. When viewed on a dental image, a porcelain fused to metal crown has two components. The metal component, which is the understructure of the crown, appears completely radiopaque, and the porcelain component, which is that porcelain thin porcelain layer that's layered on top of the metal, appears slightly radiopaque. Composite restorations, when viewed on a dental image, may vary in appearance from radiolucent to slightly radiopaque, depending on the composition of the composite material. Some manufacturers of composite materials add these little radiopaque particles to their products to help the viewer differentiate or tell the difference of a composite restoration from dental caries or dental decay. Acrylic resin restorations are often used as a temporary crown or filling, and of all the non metallic restorations, acrylic is the least dense and appears slightly radiopaque on a dental image. Some of the identification of materials used in dentistry um, include restorative dentistry, um, things that are used in endodontics, things that are used by prosthodontics, orthodontics, and then also oral surgery. So, the materials that are used in restorative dentistry include base materials and metallic pens. And base materials are used in the oral as oral cavity liners to protect the pulp of the tooth. And as a base material, they appear radiopaque. And compared with amalgam, the base material appears a little bit less radiopaque. Metallic pins are used to enhance the retention of amalgam or composite and appear as cylindrical or screw shaped radiopacities on a dental image. So sometimes when we have a very large restoration, like a very large composite or a very large amalgam, sometimes they use these little pins, which are almost designed like rebar in cement, that kind of hold the restoration in place. So it's just a retention tool. Some materials used in endodontics include gutta percha and silver points. Gutta percha is a rubber-like material that's used to fill the canals of the pulp, and gutta percha appears radiopaque with a similar density to that of base materials. And when compared with metallic restorations, gutta percha appears a little less radiopaque. Silver points are also used in endodontic therapy to fill the canals of the pulp, and silver points appear highly radiopaque, similar to other metallic materials. Silver points appear more radiopaque than gutta percha. And silver points are something that they used to use to fill the canals and root canals. We don't see them too much anymore. And unless your endodontist is 90 years old, you probably won't see any of them being done either. They're a very old technique. Some materials used in prosthodontics. Um, so the appearances of complete and removable partial dentures vary depending on the base and type of the denture that's used. Um, Patients should be instructed to remove all complete and partial dentures before the image is exposed. And these can include complete dentures or removable partial dentures. And a complete denture that is not removed before the exposure of a dental image gives the illusion of rootless or floating teeth. And a removable partial denture, also known as an RPD, with a metal base, uh, um, it's usually constructed of a metal base with acrylic saddles that appear densely radiopaque where metal is present and only slightly radiopaque in the areas of acrylic. A removable partial denture is constructed of totally a removable partial denture base is totally constructed of acrylic is usually seen with wrought metal clasps. Materials used in orthodontics include orthodontics bands, brackets, and wires, and they all have this characteristic appearance of brackets. And then we can see a picture of what that looks like on page 392, figures 32-38. Some materials used in oral surgery include so we have implants that are being used with increased frequency. And the appearance of the numerous endosteal implants that are currently being used vary depending on their shapes and designs. Also, suture wires, metal pins, splints and plates, bone screws, and stabilizing arches are used in oral surgery to stabilize fractures of the maxilla and the mandible. A number of miscellaneous objects, including earrings, necklaces, nose jewelry, eyeglasses, napkin chains, hearing aids, and shrapnel, can be viewed on dental images. To avoid non diagnostic images, patients should be instructed to remove all earrings, necklaces, nose jewelry, eyeglasses, napkin chains, and hearing aids if possible before exposure of the extraoral image. Jewelry um, and other radiodense objects, such as metal earrings, can cause an artifact known as a ghost image. And ghost images can obscure important information about teeth and bones and render the image non diagnostic. So, things like jewelry should always be removed prior to any x rays. Also, necklaces may appear on the extraoral image as a radiopacity that corresponds in shape and size to the necklace. Other miscellaneous objects include eyeglasses, where the metal portion of the frames appears as a radiopacity on the image, a napkin chain that may be seen on an extraoral image, not necessarily an intraoral one. Hearing aids, if they contain any metal components, should be removed prior to the exposure of the extraoral image. And also, shrapnel or small metal fragments that can scatter outward from any exploding device may also be seen on the dental image. Okay, that's all I have for this chapter. Please let me know if you have any questions, as always. Thanks, and we'll talk soon.